Hello everyone and welcome to today's podcast. I am Mansi and today we have a very special guest with us, Dr. Shashank Dhanuka, a renowned urologist from Kolkata, who is here to address an issue which impacts a lots of men around us, that is MSD, male sexual dysfunction. Welcome sir, thanks for giving us the time.
Thank you very much. Thank you for having me on this program.
And sir, to start, can you please give us an overview of this particular male sexual dysfunction? What is it and how common it is?
So male sexual dysfunction or MSD is a very common problem which is very less discussed in the society.
Right.
It comprises of a lot of things including arousal disorders, a low sex drive, erectile dysfunction, premature ejaculation. All of these fall under the umbrella term male sexual dysfunction.
Okay, sir. So I can sense it's a little bit complex situation which can trigger by many causes, right?
Absolutely.
So what are the mainly common causes of this male sexual dysfunction?
As rightly said, male sexual dysfunction is a multifaceted, multifactorial problem. A lot of men suffer from this disease and there are various underlying conditions, underlying causes which result in this condition. So grossly, I would divide it into three headings. Number one, psychological. Number two, physiological, including the vascular health. And number three, lifestyle choices. Coming to the psychological aspect, most of the men, including youngsters as well as middle-aged men, have issues related to stress and anxiety. This majorly results in male sexual dysfunction. Coming to number two, physiological, including the vascular health. So a lot of hormonal issues and a lot of healthcare conditions like diabetes, hypertension, obesity, lipid disorders can result in male sexual dysfunction as well. Regarding lifestyle choices, the habits of smoking, alcohol intake, as well as tobacco abuse is known to cause male sexual dysfunction. So in totality, it's a multifactorial problem which requires an in-depth assessment and resultant treatment.
So sir, discussing this sexual problem in our society, I think it's still a taboo because people are not so much comfortable, in fact, with sometimes their spouses or the parents, the sexual thing. So is there any myth or particular taboo with this male sexual dysfunction?
Absolutely, very rightly said. It is still a taboo to discuss these things and there are lots of myths associated because it is a taboo subject. So, first of all, the discussion of male sexual dysfunction should become open. It is just like any other function of the body and it should be brought to the front, whether it's a teenager or whether it's a middle-aged man. It should be discussed openly with the spouse, with any close friends, as well as with the healthcare professional like a urologist or an andrologist. Regarding myths, there are a lot of myths associated with this condition. This is because of ignorance or wrong ideas in the minds of men. Some of it is because of the content they consume and some of it is because of the things that people discuss out of ignorance. So programs like these where we discuss the scientific substance behind MSD, it helps to remove those taboos and remove those myths from the minds of men. So I think this is a wonderful program, wonderful attempt to remove those limitations regarding MSD.
Thanks, sir. So already we understood that what is a taboo of this MSD. So now if as a doctor you are treating this MSD, so what is the first treatment line or what you will suggest to your patients, sir?
As I said during discussing the causes, so because the disease is multifactorial, we have to treat it in a scientific manner, assessing each and every cause which might be the reason for MSD in that particular individual. So we have to individualize the treatment based on the patient or based on the person who's consulting us. Regarding the lifestyle choices to begin with, we have to stop the habit of smoking, alcohol intake or tobacco abuse. That is a proven factor for causing MSD.
Okay.
Second is to improve the general health condition of the patient, in which we have to take care of the physiological factors, whether it's diabetes, whether it's hypertension, whether it's a lipid disorder. So there are appropriate medications for those. After assessment, we can give them those medications. Coming to the vascular health or coming to the disease per se, the primary thing is a group of drugs called PDE5 inhibitors. This is the first line of medication that is used for most of the patients, in addition to the lifestyle and the psychological aspects. These are used in various doses and these are available in various formulations, but it is very important to understand that they should be taken under the supervision of a doctor, preferably a urologist or andrologist.
Without prescription, they should not take any
yes.
this type of medicine.
So in India especially, these drugs are available sometimes over the counter, although officially they are not allowed to be sold over the counter, but people are able to get these medications from a local pharmacy and they use it without any supervision, without understanding how to use it, what is the proper dose, what is the proper duration. So it has to be scientific. In addition to the first line of drugs and some supportive medications, there is an increasing role of prosexual nutraceuticals in this domain. These are a newer class of supplements or additive medications which contain a lot of active ingredients. Some like L-arginine, vitamin D3 and zinc are proven to improve sexual function. So they are present in these medications and they are much safer than the conventional medications. So a combination of a prosexual nutraceutical along with the conventional medications gives the best result.
Okay.
In addition to both of these, psychological counseling or taking care of stress and anxiety is very, very important to come out of a sexual dysfunction.
Okay. So, sir, what we can understand with your view that prosexual nutraceuticals are safer drugs and patient can take it for a long time.
Absolutely, but under guidance.
Under guidance, obviously.
Yes.
And sir, I just would like to ask you, what is the next you are thinking for how you can see the MSD treatment or maybe the future of the MSD? Yes.
So, with the changing environment, I believe that number one, the taboo and myth about this is slowly going away because the newer generation, the youngsters are more open about it. And with more awareness programs like these, more and more people are able to understand that it is just like any other disorder in the body. They are ready to seek professional treatment.
Right.
As a result, the outcomes are going to be better. So instead of going to some hidden corner of the city and trying to get treatment from a non-professional person, they are now more interested in taking professional treatment in the right manner, discussing their problems in the right manner. So this is one aspect. Second aspect is the arrival of these nutraceuticals and more newer medications which have less side effects, which are more specific, which are more efficient. The combination of these two things is helping us to deal with this disease in a much better manner. Okay. So the satisfaction level of the men who are suffering from MSD after this treatment is now much better. In my own practice, I have noticed that the men and even the couples who come to our clinic, they are feeling much more satisfied after the treatment and their overall experience, sexual experience is getting much better with proper scientific treatment. So I feel the future is very bright and obviously we'll be better able to manage MSD as more and more research is going on this subject and more people are coming forward with their problems.
Right, sir. So thank you so much for this wonderful insight what you are giving us, and it is, I can say, it's a very informative, and lots of the listener will take a view what is a problem going with them and where they should lead with that problem. Okay, sir. Thank you.
Thank you very much. Thank you, Mansi, for having me on the show.
Thank you, sir, so much.
I am very grateful for the organizers for choosing a topic like this for an awareness podcast because this is very relevant to everyone, and I'm sure that programs like these can remove the darkness of taboo and myth from people's minds and they can seek professional help when required. If any of you is suffering from any of the conditions related to MSD, do come forward. There's nothing to be shameful about. It's a very common problem. Millions of men suffer from this. You're not alone and there is help available.
And wish you a very happy Men's Day, sir, as this is a Men's Day and you want to share any particular message to our listener, so you can share on this day, sir.
I would like to wish all the men a very, very happy International Men's Day and do take good care of your health. Detect early, treat early. That's my funda. So always don't ignore your problems. Come forward, seek professional help, and take good care of your health. Thank you very much.
So thanks. It's a wrap for today's program. And please, for the more information, please visit the nearest healthcare professionals to get the better option, which is the best option for you. Thanks for the listening. Thanks for being with us.